Hello, and welcome to my talk on anxiety and the brain-gut connection. This is part 3 of our series on an integrative approach to anxiety, and my name is Reine DuBois. I'm the founder and clinical director of the Health Lodge, and it's my absolute privilege to work with such a dedicated team of health advocates and practitioners. The knowledge that I'm sharing today has been gained through the collaborative work of this team, mostly from our bi-weekly meetings, but also our combined consultations as well. So I'm going to be looking at 3 areas. I'm going to be looking at the overlapping biological systems involved in anxiety, in particular in this talk, the nervous system, the endocrine system, the digestive system, and the immune system. I'm also going to be looking at the biological drivers involved in anxiety, factors including brain chemistry and nutritional levels, looking at how they impact the nervous system. I'll also be presenting on some functional medicine testing we use to assess the different biological drivers involved in the brain-gut connection. I'll also explore how digestive issues can be a main driver of anxiety, in particular the production of histamines, oxalates, and lipopolysaccharides from dysbiosis. So what is systems medicine? Systems medicine is an interdisciplinary field of study that looks at the systems of the human body as an integrated whole. It looks at how the systems of the human body interact and influence each other when they are in balance, but also when they are not in balance. For the sake of this presentation, I'll be looking at the overlap between the digestive system and the nervous system, and it's not uncommon to see the involvement of the endocrine system and the immune system. You may have heard the saying, the gut is the second brain. I wonder how we would view mental health conditions like anxiety if we consider the gut as the first brain. It's commonly understood that anxiety is a factor in the cases of IBS, irritable bowel syndrome, suggesting that the cause of irritable bowel syndrome could be coming from the central nervous system. As a matter of fact, 84% of patients with IBS experience anxiety, versus 14% of patients with anxiety having IBS. So nearly all patients with IBS experience some form of anxiety, but not all patients with anxiety experience irritable bowel syndrome or digestive issues. We all know the feeling when we're anxious, public speaking, for example, and the effect we may experience in our stomachs. It's not uncommon to experience diarrhea, loss of appetite, intense thirst, butterflies in the stomach. What is actually happening in these moments is the blood vessels surrounding the stomach and intestines constrict, contracting the digestive muscles. The parasympathetic nervous system, in contrast, exerts both excitatory and inhibitory control over the gastric and intestinal tone, shutting down absorption, secretion, and motility. So with this in mind, you can understand one of the main biological drivers of anxiety could come from long-term stress, creating what we call a sick digestive system. With the release of both excitatory and inhibitory neurotransmitters influencing the control over gastric and intestinal tone, you understand the progression. For example, long-term stress may lead to reduced hydrochloric acid, reduced nutrient absorption, and ongoing constipation and diarrhea, both of which are classic to IBS, leading to a reduction in energy and disturbed sleep patterns, leading to what we call a reduction in the window of tolerance of stress, which Simon talked about in his talk, but also different food groups. The window of tolerance for food groups may reduce, leading to an increase in use of coffee and alcohol to help with that reduced window of tolerance of stress, further interfering with hydrochloric acid production, and the cycle goes on and on. This often results in a disruption of the metabiome, leading to an overgrowth of pathogens. And in particular, I'm going to look at pathogens that produce histamines, oxalates, methane, and lipopolysaccharides. So just recapping on this concept that Simon touched on in his talk, the window of tolerance. And this is a concept when the human system is dysregulated by a disruption that impacts the person's capacity to regulate effectively in the face of stimuli, whether this be internal or external. It disrupts this window of tolerance. So it could be a stressor, but with this syndrome, it may be a food sensitivity. As that window of tolerance decreases, our ability to tolerate different stressors like certain foods, like maybe wheat or dairy, will also decrease. Another example, if someone has PTSD or long-term stress, this can lead to poor digestive function, leading to impaired nutrient absorption, creating low levels of neurotransmitter production, such as serotonin and dopamine, leading to anxiety and depression, further reducing the window of tolerance. So what is dysbiosis? Dysbiosis is a condition when the gut bacteria become imbalanced. The imbalance is between the types of organisms present in the person's natural microflora, especially that of the gut. We've got certain amounts of both beneficial and pathogenic bacteria, and the issue arises when the ratios between these beneficial and pathogenic become imbalanced. Things that can also push this dysbiosis, further reducing our window of tolerance, are things like excessive antibiotic use or bacterial, increased consumption of sugars and refined starches, processed foods, additives like preservatives, and interestingly, artificial sweeteners as well. Traces of harmful chemicals and toxins in our food and environment can drive a dysbiotic picture. And one we often overlook is poor dental hygiene, which allows bacteria to grow out of balance in the mouth, creating the dysbiosis in the mouth, first of all, leading to the gut. So there are quite a few histamine-producing species that have been identified. They've been studied and isolated. And the main species that have been cultured that typically produce histamine or are histamine secreting that we often see are species like Klebsiella and Citrobacter. And these species can trigger a high level of histamine being produced in the gut, setting off an immune systemic inflammatory response, which Dr. Igor did discuss. Histamine will have different effects on different systems depending on where the site of damage is. So it really depends on which site or system that histamine is having a damaging effect upon. I'd like to acknowledge that this is one of Igor Tabrizian's slides we often use in clinic together to help explain this story of histamine and its effect on the different systems or sites. For example, if histamine has crossed the blood-brain barrier, it will likely express as headaches, brain fog, insomnia, and anxiety. And this is its effect on the central nervous system. If it's affecting the skin, you'll often see rashes and hives and uncontrollable itch. But these symptoms may not always be present with the histamine excess. If it affects the digestive system, you'll often see bloating, loose stools, reflux and heartburn. And of course, if it's having its effect on the respiratory system, you'll often see shortness of breath, cough, wheezing, nasal congestion, hay fever and snoring is a common histamine symptom. Histamine has a diverse presentation depending on what system or systems it's affecting. And the best way to explain this, I feel, is with a case study. So this is the case of a 62-year-old female. She's experienced long-term anxiety even as a child. Her parents were immigrants to Australia and they always felt like they didn't belong here. She's had a long history of allergies and asthma in particular. She has occasional diarrhea, but never had a good stress resilience picture. Her window of tolerance she had already worked out was quite limited, so she was careful not to overcommit in this area. She's been on a restrictive diet for almost 40 years, once again identifying a very low window of tolerance for different foods, and the wrong foods would spike her allergies straight away. She's since been having some severe bouts of dizziness. She has many practices to help with anxiety, but these new bouts of dizziness have spiked her anxiety next level, and she's now experiencing panic attacks. She's also experiencing frequent depression and irritability. So I want to take a little look at the pathology that we did for her. MCAS stands for mast cell activation syndrome, and look at the anxiety and the gut-mediated part of this. So to start with, her IgE has always been incredibly high. Long term, she's had a low normal white cell count, but for a very long time, her neutrophils have been incredibly low. As is this most recent pathology. But this most recent pathology as well, her eosinophils have gone up. And even though she has a long history of allergies, she's never had raised eosinophils before. We went on and did her ECP, and I'll get into that, but that was raised as well. So when we see neutrophils, low white cell count, they can be the cause of chronic long-term stress, in particular when we see the low neutrophils. Now, neutrophils make up the largest fraction of the white cells, and they're produced by the bone marrow, and they're our first responders. They help prevent infection by blocking, disabling, digesting, warding off invading particles and microorganisms. We often see low neutrophils with parasites. We can see them in toxicity and allergies, which we commonly know. We can also see them low in autoimmunity, and immunosuppressive drugs will obviously lower them. But her eosinophils going high this time around, most recently, we would put that down to two things, either parasites or allergies. Now, because it's an anomaly in her picture, I'm going to put it down to parasites, or that's where my brain's thinking we should take investigations. Her ECP, eosinophil, cationic proteins were also very high, indicating eosinophil syndrome. Now, we often see skin rashes and urticaria, which she was getting some hives on and off, but dizziness is a main symptom of this syndrome. Long-term confusion and memory loss, shortness of breath and fatigue are also symptoms of this syndrome. We also did an interleukin cytokine panel and found that she had raised interleukin 8. Now, I don't know if you remember Dr. Igor Tabrizian's slide that he did around interleukin 8. But his thing was that IL-8 is the machinery and histamine are the bullets. And so this is a classic combination where you have an inflammatory process that is raised, and then you bring more histamine into the picture, creating further inflammation, and as Dr. Igor points out, and creating more anxiety due to the inflammatory process. So we did her metabio, and she did indeed have quite high histamine levels, and we would assume sitting in the large intestine, so explaining her dizziness and increased anxiety. She also had raised hydrogen sulfide production and quite poor microbiome diversity. She had poor butyrate production as well, and they also found this blastocystis that was toxin producing, and there were quite high levels of these toxins, and so we know dizziness can be a symptom of excess toxins, but all of these can be driving the low neutrophils that we saw in the white blood cell count. So we went on and did her GI mapping, her complete stool analysis, and it revealed other histamine producing bacteria. Blastocystis did show up again, that we noted in the metabiome that was toxin producing, possibly driving anxiety and dizziness. But she also presented with a very low secretory IgA, so no immune frontline defense. which we also saw with the low neutrophils and the low white cell count overall. You can see there was quite a big pathogenic load there. A couple of them in there are sulfur producing, histamine producing, and they didn't specify the toxins from the blastocystis, but we know we've got a toxic load in there, all driving this anxiety picture due to an MCAS presentation. So the treatment protocol, and I don't want to go into what we used too much, but I sort of just want to give an overall, we know this patient has had a long-term history of histamine metabolism problems. We know there's been issues with low immune function in the past, the low secretory IgA. I mean, she can't fight those pathogens off. Now adding to the histamine load, creating a new symptom load of dizziness and anxiety. We suspect there is some genetic involvement, and we're waiting for her DNA panel. But her treatment at present, we are working on supporting her secretory IgA, that gut immunity, and helping the body to metabolize histamine and hydrogen sulfide. But we're also helping to balance out those neurotransmitters, dealing with neuroinflammation specifically, which we suspect is driving part of the anxiety picture. So pathogens and genetics in this case were driving the production of histamine and hydrogen sulfide, leading to anxiety. So another case study, which I think is worthwhile just jumping into, was a case study of a 13-year-old female. She presented as easily overwhelmed and having daily outbursts of anger, but she was also having daily sadness spikes. Her sadness and anger spiked since the age of 12. She didn't present with any allergies, but she had this temperature dysregulation. She ate most foods, but in particular craved avocados, tomatoes, olives, blueberries, and potatoes. She would often feel sick just before school, hot and cold and sweating. She was easy to tears, very emotional, and her periods had not started yet. Headaches most evenings, and this had been a long-term issue. The last 6 months she had been experiencing a bit more fatigue, and constipation had been a long-term issue too. Her anger was always worse for her blood sugars dropping, and she presented dark under the eyes. She spoke about the occasional stomach aches, but the family couldn't get clear if they were stomach aches or if they were more anxiety. So we started with a neurotransmitter panel for her. And I think there was a lot of clues. When we got this back, it was really evident that there was something going on with the neurotransmitters. So the first thing that jumped out was this very low serotonin picture. And it made sense to us that with the craving of potatoes, the poor temperature regulation, easily overwhelmed, constipation symptom, and the anger when blood sugars dropped, that we did have something serotonin in this picture. And we introduced, after this sample was collected, but before our follow-up, 5-HTP and vitamin D, just supporting that serotonin metabolism. And the parents reported when they came back to get these results that it had stabilised her mood significantly. However, the constipation and the headaches continued. These results also revealed inflammatory urinary markers were raised, in particular that chiarine, which is a metabolite of tryptophan pathway and a predictor of depression. So as well, we saw her excitatory neurotransmitters were high, such as histamine in there. Tyrosine was high as well, and her DOPAC was also quite high. And so now we're starting to get the explanation of why headaches, the darkness under the eyes, the spike in mood, brain fog, and the anxiety before going to school. So because she had the high levels of DOPAC and the high chiarine, there is one thing that can disturb both those pathways, and that's dysbiosis. In particular, Klebsiella Clostridia and Citrobacter. They're the classic pathogens that can disrupt both the dopamine pathway and the serotonin pathway. So it made sense to us that we would do a comprehensive digestive stool analysis. And what we found was a very low secretory IgA again, so no frontline defense, and we don't know what came first, the chicken or the egg, but definitely that secretory IgA would have been contributing. What we often see can be the causer of a low secretory IgA, long-term mental, emotional or physical stress, driving adrenaline and cortisol has been well studied to decrease secretory IgA. Chronic infection can also deplete secretory IgA. So it's possible with some of these pathogens, the Campylobacter may have lowered her secretory IgA frontline defense. Medications can do it, and in her case, she'd had long-term headaches and maybe just the frequent use of Nurofen and Panadol. And poor dietary choices can also lower this frontline secretory IgA defense. So with a low secretory IgA, it can lead to dysbiosis, creating an overgrowth of histamine-producing pathogens interfering with tryptophan and tyrosine metabolism, going on to interfere with dopamine and serotonin production, leading to anxiety, mood swings, headaches, and depression. We did do her genetics in the end. We completed a DNA wellness profile and found that she had a fast MAO and a slow DAO. So a fast MAO means whatever serotonin she did make, she was clearing too fast. And a slow DAO meant those rising levels of histamine couldn't be cleared fast enough. She did, and it doesn't show on this slide, had issues with her vitamin D receptors, which is needed for serotonin production, and she did have a slow GAD and BDNF interfering with GABA production, which I won't go into too much. But what I might use is another diagram that Dr. Igor Tabrizian made, and we use it a lot in clinic to explain the interactions of genetics and neurotransmitters. So if we were to look at her variants, she had poor vitamin D receptors, she had pathogens interfering with her tryptophan metabolism, so poor serotonin clearance, and then that fast MAO means what little she's making, she's shredding way too fast. To add to that, she had the slow DAO, making it hard to break down histamine and the methylhistamine, which were both high in her neurotransmitter panel. So these weren't being cleared effectively enough. She also had the GAD and the BDNF, so meaning that her production of GABA was poor and her clearing of glutamate, that excitatory neurotransmitter, was slow. So her treatment protocol, again, I don't want to go into it too much, but focusing on secretory IgA. And I just want to make a point here that neither of these treatment protocols did I use antimicrobials. Instead, upregulating that secretory IgA using powders with zinc carnosine and quercetin to help restore the gut immune function. We use Saccharomyces boulardii, once again, to help upregulate secretory IgA production, and a probiotic, this is a high dose one for children, to support immune function and histamine reduction. So I'm not a fan of the antimicrobial process. I don't think there's anything more sophisticated than our own immune system. And so hence that's why my focus is to get that frontline immunity working again so it can address the pathogen imbalance, the microbiome imbalance. We used neurotransmitter support. Now, she was already on the Primer Plus when she came, and her parents noted whenever she stopped that, her mood definitely declined. We just brought in some fish oils, the D and the 5-HTP. And so another case where pathogens producing histamine excess were interfering with tryptophan, but also tyrosine metabolism. And so another slide by Igor that we use in clinic, just outlining how histamine is a main player in a lot of systems. So it works on the central nervous system and has a massive effect there in a lot of mental health conditions. It can work on the bone marrow, reducing that white blood cell count. It can work on the digestive system, which we commonly know. It can work on the uterus. You know, we often see this with excess estrogen and painful periods. Quite often, if we metabolize histamine that's being produced from the gut, we'll get results there. Not uncommon to understand its interaction with the respiratory system and the skin, but it can also affect the cardiovascular system as well with those racing heart symptoms. So nutrients and probiotics used to lower histamine. These are the nutrients that I commonly use in clinic. Vitamin C is well reputed for its histamine clearing effect, in particular intravenous vitamin C. We've seen incredible things with B12, zinc and magnesium are all essential in the breakdown and clearance of histamine. Quercetin and bromelain are two favourites in this camp. Do have to be careful. Quercetin can slow COMT down, so if you do have that genetic predisposition, you need to be careful. Really like the enzyme HisDAO. DAO helps to break histamine down, mostly at a gut level. Binders will often use to bind histamine, but oxalates, lipopolysaccharides, methane. PEA is another one that's a mast cell stabilizer. And then probiotics. And these probiotics in particular we found to be useful in reducing inflammation, but also supporting the clearance of histamine and the regulation of the immune system at that gut level. Foods that are high in histamine, worth just touching base on. Things like champagne and red wine we commonly know are high histamine, but we don't often understand how avocados and bananas can be very high. And the broths, all of the broths can be super high. Vinegar. The other thing is leftovers. Every day that we sort of keep those leftovers, they do increase in histamine levels. So it can just be another layer adding to that histamine load. Is those foods, and in particular in that last case study, avocados and bananas were two of the foods that she was craving. So with anxiety, it's important to recognise the overlap of the systems. It's usually never just the nervous system. It can involve the digestive system and the immune system. It can also involve the endocrine system or the hormonal system, which is another talk. And but it's usually layered, and it usually takes a few investigations to understand the layers of what's driving anxiety and that brain gut connection, and then balancing that connection. So, you know, as a team at the Health Lodge, we work from this perspective as individual clinicians, but as a team as well. And whether it's in our collective clinical team meetings, where we're presenting patient cases with their permission, or working together in the clinical rooms with the patient, such as the combined appointments that Dr. Igor and myself have frequently, or learning through these education processes like these talks, there is this beautiful handover of knowledge and this understanding of the merging of the layers in people's complex health. Our vision is changing the future of medicine together, and it really does show that significant acceleration in understanding and treating health conditions when a range of modalities work together in an integrative way. So it's my privilege to present this information and work with this team. And so I'll leave you with our values of our practice, and I thank you for listening.